Hey everybody, good morning. It's Dr. Brian Prax, Clinical Director here at Chronic Care Charlottesville. And I have a little message for you today, and I'll title it something to the effect of percent of pain. Percent of pain. Oftentimes, very frequently, I get patients coming in. Of course, we're usually the last stop, so they've already been to this doctor and the physical therapist, and they've been to other chiropractors, et cetera, et cetera. And a lot of times they'll say, listen, I'm bone on bone. It's interesting how people will identify themselves as, I'm bone on bone guy. My doctor said I have bone on bone. And they're talking about knee pain, where the pain is supposedly, all of the pain is coming from arthritis, where the meniscus, this white tissue that's in between, kind of acts as an absorption and gives a little bit of slipperiness to allow the bone to move. Well, when this wears away completely, then you're not cartilage on cartilage anymore, which is what you're supposed to be. You end up becoming bone on bone. And let's face it, that can certainly be a cause of knee pain. But I want you to get that. It can be a cause of knee pain. And I often find that bone on bone, although a cause of knee pain, isn't the entire source, all of the sources of one's knee pain. And this goes for foot pain, it goes for back pain, etc. There are so many other components, and when I take an x-ray or the hospital takes an x-ray, what we're looking at is one component, right? That's the skeleton. So skeleton has nerve endings that go to it. Bones have nerve endings that go to that. And those nerve endings, if irritated, will fire up to the brain, the pain centers of the brain, and you'll get a sensation of, ouch, that hurts. But you've got to understand there are so many other pain fibers that are more than likely firing off that we need to know about. And I love the old serenity prayer. Okay, so the serenity prayer says something to the effect of, be concerned about the things that you can change. Don't be too concerned about the things you cannot, and have the wisdom to know the difference. So let's think about that. We've got lots of sources of pain, especially for the knee. Bone, cartilage, okay? There could be cysts forming that can cause pain, but particularly in knee pain, Baker's cyst. That needs to be ruled in or ruled out. There could be tendon problems like a tendonitis. It could be a muscle problem. It could be a circulation problem. It could be an outside disease like maybe diabetes can be a source of pain. Multiple sclerosis. There's a bunch of different causes of pain. And what I most often find is that it's multiple straws on the camel's back. And let's just say if you're bone on bone, what if 25% of your pain is coming from the bone on bone? Then we have to ask, where's the other 75% of the pain coming from? And what if I was right and if only 25% of your pain is coming from your bone on bone or your arthritis, and you go in and say, I need to have a surgery because I'm bone on bone. And you go in and get the surgery, right? They cut the top of this bone and cut the bottom of that bone, and then they hammer some things in there. Now you have bionic knees. But if 75% of the pain isn't taken care of, like muscles, tendons, and other forms of pain, if those aren't taken care of, you're still going to be left with some symptoms. So what I always suggest is going as low invasivity as possible. Make sure that it's not a muscle problem, a tendon problem, or any of these other problems. And that's what we do in the office. Certainly some people need to have surgery. Some people, the majority of their pain is coming from bone on bone. But the lesson is, I don't want you just to think or just settle or even identify with, well, I'm bone on bone, the doctor says, then that's what I have to have. I have to have my knee operated on. Not always. Not always. There are things out there that you can do for your pain. So in terms of percent of pain, make sure that you check muscles, tendons, ligaments, and other sources of that. With our knee program, that's exactly what we do. We're going to check those other sources of pain, which I most often find that the vast majority of folks' pain, the vast majority of the reason why they have an inability of squatting down, bending over, walking up steps, down steps, sitting on the toilet, getting off the toilet, daily living things, oftentimes the majority of their pain is not from the bone. is actually from those other tissues. That's the message for now. Just because you're bone on bone or just because you have arthritis doesn't necessarily mean that that's where all of your pain is coming from. You may be one treatment away from feeling so much better, even with bone on bone. And yes, I have many, many patients who've come in flat out bone on bone. They get some trigenics, some laser treatments, things like that, and the vast majority of their pain goes away. And more importantly, they're able to do things better and more in their life. So I hope that helps, and look forward to hearing from you, and look forward to hearing and seeing and reading your comments below. I will respond. You have a great day.